Mother's Day is just over a week away, so it's the perfect time for a mommy makeover. And Dr. Bruce Landon is the person to help you restore that pre-pregnancy body. He's back with a special offer to make it the perfect gift. Good to see you, Doctor.
It's nice to see you too. Thanks so much for having us back.
Yeah, I love that we're talking about this, certainly around Mother's Day too, where we want moms to feel special and appreciated, and it's so much more about how we look, but it is true with, I'm sure you see it in your business, it's how you feel. Yeah. And sometimes moms lose that.
They lose a lot of it.
Yeah.
I think some of the post-pregnancy changes that most women experience they're devastating.
Yeah.
You know, there's no longer a good time for bathing suit wear. They avoid situations where they, you know, have to bear a little bit more than normal clothing, and this is it's a game changer for them. And
you don't want moms to not go to the beach and enjoy, you know, fun times with their kids or do anything, but how is it that your office is able? I mean, when you look at someone who's ready to kind of reshape and have their figure back that they once had, where do you begin?
Well, the most important thing is to get them to prioritize, because it's not, despite the fact that the mommy makeover is really a combination of some element of breast surgery and belly contouring, there's a lot of times where it may not be appropriate to do both at the same time. So prioritizing, getting a sense of which one of the two elements perhaps has had a little bit more damage and change from those pregnancy periods. And so that's a good place for us to start. Do we want to start up top? Do we want to start down below? Are they a good candidate for both? And that has a lot to do with their overall general health, the age of their children, what their work allows them and won't allow them to do from a standpoint of recuperation. So that's kind of where we start, is prioritizing where do we need to focus our attention first. And
if you are going to have this work done, I mean, do you need to know in your mind that you're done having kids, or that this is kind of, you know, the final outcome for your body? I mean, where in life, of the stages in life, is it okay to go ahead and have some of this work done? You know,
it's a great question. I think that we do prefer that they kind of have come to the end of their childbearing years, although it's not essential. Look, a lot of people have relationships that end and new ones begin, and childbearing happens all over again. And none of the things that we do would be an impediment to that moving forward. But it is nice when they get to the point where they're finished having children, then we can see the changes that they're dealing with and then help them manage it from there.
What are the most popular procedures? I know we kind of hinted at them a little bit, but what is it that you're talking about specifically that could really help kind of get our figures back?
Well, so specifically, with each successive pregnancy, there's a percentage volume loss in the breast. So most women are looking to help restore some of that lost volume, and it can be substantial with even a single child. Doesn't necessarily have to be that they've had multiple children. Oftentimes there's a skin relaxation element, so a lift procedure can oftentimes be combined with an implant. So if they need to restore volume and they need to put that volume into a better location, then that would be kind of a lift with an implant product. And then with regards to the tummy, the typical post-pregnancy changes would be some relaxation of the muscle compartment, some skin laxity that, despite people's diligence with going to the gym and diet and exercise, these are things that, Carly, we can't exercise back into place. And so this is where surgery has a great role to play in helping them remove the extra skin that's not going to cooperate with their lifestyle, restore the integrity of the muscle compartment, and then a little bit of liposuction is usually a part of all of these procedures.
And as we wrap up here, I want to make sure, because it is important to note, this is not necessarily a weight loss plan. I mean, you have to be a good candidate for this, correct?
Yeah, you're gonna get so much more out of it if you approach it in the sense that this is just a restorative procedure. It's going to put you back to where you were pre-pregnancy, but it's not going to be a solution, nor would we ever embark on somebody's surgery as a solution to the fact that they might have put on 50 pounds, 60 pounds, 70 pounds with a pregnancy. That's imperative that they get most of that off first, and then we can take it from there.
Well, again, we love how realistic you are with their goals, and certainly if anyone wants to find out more, and you have a great special right now. You say for our viewers you'll take $1,000 off, maybe that mommy makeover. So moms, again, maybe it's time to kind of reevaluate and make you feel good about yourself again. Here's a way to do that. There's the info, the phone number to call as well. Thank you so much, Doctor.
Thank you very much.